Hey guys, Dr. Aaron Ferguson here with 𝒂𝐶 Chiropractic and Wellness, and today we're talking about 3 tests that you can do at home to help determine if your low back pain is something that could be helped by chiropractic care. Now, the first test that we're going to talk about is going to be the seated compression test. Now, to do this test, what you need to do is just find a seat or a bench that you can sit on. Make sure you're sitting nice and tall through the spine. You'll take the hands and grab either the bottom of the chair or the bench really close to your body. And then you can use the hands to pull up, which will compress that lumbar spine together, and it may or may not elicit pain. Now, if it does elicit pain, then there could be some issues going on, whether it be the disc or the facet joints, or even the nerves getting irritated. If you're having that, we definitely want you to get checked out by a professional and determine what is really causing your pain. Now, the second test we'll be talking about is called the lying extension test. So to do this test, what you'll need to do is find either a floor or a bed to lay on, and you're going to go face down. So lying face down, you'll put your hands directly underneath your shoulders, and you will slowly push yourself up into extension. Now, this test can be positive whether it causes pain or not. Now, if it does cause pain, please don't keep doing it over and over again. But if it relieves pain, that actually can be a therapeutic exercise for you. All right, and the third exercise that we're going to talk about today is just range of motion. This can be a strong indicator, and something we should have in every range of motion is good mobility. But oftentimes, when you actually look through and test, you'll find that there'll be some problems along the way. So to do this test, we're going to go in every range of motion. The first one we'll start with is flexion. So you're going to flex forward and touch your toes. From there, you'll stand up straight. You'll block your tailbone, and you'll extend back over your hands. And then we'll put our hands on our thighs, on the lateral part of our thighs, and we're going to slide down the thigh to the left side, and then we'll go back to the right side. And then the last one is rotation. We'll cross our arms over our shoulders, we'll rotate to the left as far as we can, and then we'll rotate to the right as far as we can. Now, when testing range of motion, things to pay attention to are, do I move equally from side to side and in rotation and lateral flexion? Is there pain caused by flexing forward or backwards? Or do they take away some of that pain? All those things can be indications for chiropractic care, and it's just important for you to understand what's going on with those. Now, these 3 tests are simple at-home tests that you can do yourself. Now, I want to be very clear, they're not meant to diagnose your problem, but it does give you an idea if you could be a chiropractic patient or a candidate for chiropractic care because of your condition. If you are having pain in any of these exercises, I just want to be very strong in saying don't do them over and over again, because you can irritate the area more than we want and cause further problems. If you are having any of these issues, we'd recommend you get checked out by a professional and get it on top of the issue as soon as you can so you don't have a bigger problem down the road. I'm Dr. Ferguson with 𝒂𝐶 Chiropractic and Wellness, and we'll see you on the next video.